Chandray Rheumatology and Immunology Center and Research, a center with a difference. Patient awareness talk by our experts in the field of rheumatology, clinical immunology, allergy and reproductive immunology.
Good evening, everyone. Today we'll be discussing about NSAIDs, the role of NSAIDs in the pain management, various use and abuse of those drugs. First of all, what is pain? I hope you might have listened to my previous colleagues' lectures in the other days, so where they have discussed about what is the description of pain as well as the psychology of pain. So it is nothing but an unpleasant sensation. It could be a sensory as well as an emotional disturbance which the patient might be experiencing. And also it's an important part of body's defense mechanism, and usually pain will be the most common symptoms with which a patient will be approaching his or her doctor, and also it's a sign of an active disease, as you all know. So the approach is usually will be a multidisciplinary approach. So multidisciplinary means nothing where the patient might be having an inflammatory or a non-inflammatory type of pain. The typical non-inflammatory type of pain are the pains where the patients will be experiencing over solid organs in the form of cardiac pain or renal colic or abdominal pain, etc., where we generally don't need to alter the inflammatory mechanisms. But whereas a patient who is suffering from arthritis, they'll be having usually inflammatory type of pain where we need a pain medicine which specifically act on that inflammatory pathway and reduce the problem. The other issue could be a structural damage where the patient will be suffering from various deformities or disabilities, where with the help of a splint or various support system, we can almost relieve the pain 100%. And there are some other entities known as affecting the neuronal pathway where the pain could be, the patient will be experiencing about severe burning, tingling sensation over the hands and feet, where we need to support with the neuronal medications, which we commonly call it as neuroleptics. And there is another entity like patients will be suffering from psychological distress or increased anxiety, which we commonly come across in our routine OPDs in the name of fibromyalgia, where the pain sensitization pathways are affected, and those cases where we need a psychosocial support for the patient in the form of various. So ultimately, what are the goals we want to attain when we are treating a patient for the pain management? First of all, the drug should be suitable for, and the selection should be in the right dosage, and the particular medicine should be safe and effective. Also, it should improve the quality of the life in the form of improving the patient's mobility as well as the functional status. And the ultimate goal will be nothing but a pain relief. So here I've mentioned about various classification of the pain medication, where you can see these are the classification of a non-steroidal type of anti-inflammatory pain medicines. So here I have classified as selective and non-selective medications. In selective medication itself, there are pain medicines which are having very mild anti-inflammatory action to severe and moderate to severe anti-inflammatory action. But whenever we attain a severe anti-inflammatory medications, the side effect profile also might be increasing, where we commonly see the side effect profile will be kind of moderate to severely increased in case of medications such as nimesulide, diclofenac and aceclofenac type of medication. But when we go with a medication such as paracetamol, where the patient will be having very poor anti-inflammatory action, the side effect profile also will be very less. But when it comes to medications such as celecoxib or etoricoxib, where we can achieve a good anti-inflammatory action and very mild side effect profile. Next, we'll move on to the difference between what are the benefits versus risk of taking these type of pain medication. The benefits already I have advised. I've discussed in the previous slide. Mainly, we'll be achieving a good pain relief. The second one is to improve our quality of life and mobility of the patient. and third one will be definitely to improve our functional. But when it comes to risk caused by the pain medications, we should be fully aware here. The patients who has been prescribed a medication from the right point of perspective with the right proportion of the drug from a right person generally won't land up in any sort of trouble. As you all know, I have explained here the various organ manifestations caused by the increased use of pain medication. And also one more thing you should be very much aware about this area is that the increase in age mainly in the elderly population, and also the patients who are suffering from various other chronic ailments, for example diabetes, hypertension, dyslipidemia in the form of lifestyle diseases, they are having a much more tendency to land up in trouble when they are using the pain medication for a chronic period, for example more than 6 months or 1 year or 2 year period. So here you can see the various manifestation in the brain. It could be from a simple stroke type of presentation because of the blood clots to some neurodegenerative mechanism, example being Alzheimer's disease or Parkinson disease, where the proportion here mentioned it is 20 people out of 10,000, whereas in cardiac ailment it can affect in the form of various heart pumping mechanism. Also, some cases it can affect the coronary heart blockage also, where the proportion being somewhere around 30 individuals per 10,000 population. When it comes to gastric manifestation, it can patients can land up with problems such as related to bleeding, perforation, and gastric ulcer type of formation, where the proportion number is somewhere around 10 to 11% among 12,000 individuals. And when it comes to kidney ailment, where it's a gray area because majority of our patients will be having an extreme fear of taking pain medication because it might get effect to kidneys. So here it's clearly documented that among 1 lakh population, there is a probability of somewhere around 17 to 30% developing some sort of kidney failure, maybe because of a mere fluctuation or variation in their kidney function in the form of rise in creatinine or blood urea, or new onset of hypertension with some fluid retention in the form of swelling of various body parts. So the discussion of pain medication won't be complete if you are not discussing about something called as narcotic drugs. Narcotic drugs are nothing but, because we all know that narcotic drugs are legally banned, and for example being heroin, morphine, codeine, methadone, and propoxyphene. And these type of medication pharmacologically that is actually classified as an analgesic. Basically it gives a depressant, CNS depressant type of action. But where the synthetic opioid comes, for example being tramadol and methadone, where the tramadol is like routinely we use in almost all our practice and our common type of patients also. The problem here is like you should be very much careful, like you should not land up in an opioid abuse type of tendency, where there is a high probability of you landing up with extra trouble. So what are the signs and symptoms where you can notice like a patient is having or taking in the abuse phase of an opioid drug? First of all, whenever you're not using the pain medication that follows your doctor's prescription. Second one, whenever you're using the medication to get high or relieve anxiety, not mere pain relief. And also the third one being the requirement of higher doses of the particular drug in order to feel the same effects you were used to get when you were taking the drug in the older days. So these are the signs and symptoms where you can notice a patient is taking pain medications or the opioid type of pain medication in an abusive manner. Finally, what are the take-home messages you will see about the pain medications? First of all, you should use the painkillers very wisely. See here, the important aspect is like it's always better to take the pain medication for a prescribed time by your doctor whenever you are having a problem, to remain physically and mentally active. Because otherwise, without taking painkillers, leading a miserable life, it's not wise. So always use the painkillers wisely, and you should always follow your doctor's prescription, whether it being to terminate a drug or to initiate a particular drug. You should ask your doctor's advice always. And the third point is never abuse any drug, be it a painkiller or any other medication. And the fourth and the last point would be avoid over-the-counter medications where there is a high probability that the person who is sitting in the pharmacy, who is dispensing the medication, may not be knowing like much about the pros and cons of the medication, and also where exactly the particular medication is rightly indicated or contraindicated. So in that chance also, there is a probability of patients going into other type of organ related. So I hope you enjoyed this session. So next time onwards, like whenever your doctor prescribe a pain medications, so be wise and take it whenever it is absolutely necessary. Thank you everyone.